morning, good afternoon, and good evening, and welcome everyone to today's webinar in recognition of Global AMR Awareness Week. And this webinar is hosted by the International Federation on Aging, entitled Tackling the Threat of Antimicrobial Resistance. So my name is Katrina Bazanis. I'm a Director of Policy and Advocacy here at the IFA, and I'm looking forward very much to moderating this session. So antimicrobial resistance, or AMR, is a pressing global health crisis. So every year, millions of lives are impacted by infections that have grown resistant to the medicines that once cured them. The World Health Organization recognizes AMR as one of the top 10 global public health threats. Immediate and multidisciplinary action is needed to combat this threat, particularly as it relates to protecting the health of older adults. And so today's webinar will feature 3 expert presentations on the issue of antimicrobial resistance, highlighting the risk and impact amongst older adults. Additionally, it will discuss current strategies to tackle AMR with a specific focus on the role of non-governmental organizations. So we have 3 expert presenters here with us today. So we have Dr. Ines Barish, who is a professor of health metrics and sciences and director of global health policy and partnerships at the Institute for Health Metrics and Evaluation at the University of Washington. We have Ms. Mary-Lynn Van Polgeest-Pomfret, who is president of the World Federation of Incontinence and Pelvic Problems. We have Dr. Pilar Ramon Pardo, who is the Antimicrobial Resistance Special Program Chief at the Pan American Health Organization. And so together, these 3 expert presenters will help us delve into the growing challenge of antimicrobial resistance. And so our presentations today will be followed by a moderated discussion and question and answer period. And throughout today's webinar, I'd invite you to add your voice to the discussion using the chat function. Additionally, you may pose questions for our expert speaker using the Q&A function on Zoom. So without further ado, I'm pleased to open the floor to our first presenter, Dr. Ines Barish. So Ines, thank you very much for being with us today and welcome. So Dr. Barish is a professor of health metrics, sciences, and director of global health policy and partnerships at the Institute for Health Metrics and Evaluation at the University of Washington, as well as the adjunct professor at McGill University in Canada. He is a global health policy and systems scholar and expert with background in medicine, in public health, and in epidemiology and health services management. So Dr. Barish, I'll pass the floor over to you, and thank you so much for being here.
Thank you, Katrina, for this nice introduction, and thank you very much for having me. Good morning, good evening to all of the participants, and I'm very happy to be here. Let me share with you my screen. So what I want to share with you today is to give you a brief on antimicrobial resistance, what it is, what it means, why it is important globally for health and development, and what we can do about it. So it's a presentation of about 10 minutes. I have a number of slides. I do hope that, I will go through them in 10 minutes, even though the number is 15, but many of the slides are basically about the outline. So let me start right away. Okay, so this is the agenda. What is AMR? Why is it important? Why is it becoming a major problem globally, as I said, for health and development? What is it that we can do about it? And some key takeaway messages. So let's define AMR first. We call it antimicrobial resistance. We call it microbial resistance because basically we are talking about resistance to antibiotics, which are obviously for bacteria, antivirals for viral infections, antifungals, fungal infections, and antiparasitic drugs. So the definition will be the loss of susceptibility to therapeutic agents of microbes through either natural selection or as a result of misuse or improper use of antimicrobials. So I think it is important to make this distinction because in nature itself, there is constant mutation and evolution of all kinds of microbes, a natural resistance to a number of antimicrobials. But what happens often is that in addition to that, because of the misuse or improper use of antimicrobials, we actually make it faster. That is the development of antimicrobial resistance. I have a quote on the right-hand side of the slide, which comes from Alexander Fleming, the person who invented, actually, who discovered, I should say, the penicillin, the very first antibiotics about 100 years ago. And even then, he had foresight to tell us that if we don't use it properly, if we expose patients to concentrations not sufficient to kill the microbes, then there will eventually be a resistance problem. So I think he himself is the very first one recognized that there will be a potential for developing antimicrobial resistance. So why is it important then at this stage, in the 21st century? There have been a number of studies. Actually, this is not something new. We have been talking about antimicrobial resistance for decades now, but over the last decade or so, we started paying more attention to that because we had more and more evidence pointing out to the challenges that we are facing, both for health development, as someone who has spent development of lower middle income countries. I often see the challenges as AMR not only as a health challenge, but also as a development challenge. Here on this slide, I'm trying to summarize a bit. What do I mean by that? On the left-hand side, I'm presenting data coming from a publication we had at the World Bank in 2017. We tried to forecast, estimate, I should say, what will be the impact of AMR according to three different scenarios. Low impact AMR scenario, which is rather modest, mid impact and high impact. And as we use sophisticated econometric models to estimate what will be the impact of AMR on GDP, we found out that by the year 2050, there will be a loss of global domestic product. That is everything that all countries in the world on earth are producing in a given year. There will be a loss of about 5% of the GDP, okay, in the high impact scenario. That also means that because of that loss, and as a member of a development agency at that time, Multilateral Development Bank, that is the World Bank, we were very much focused on the elimination of poverty. So it has always been a challenge for the institution. We also estimated what will be the impact on global poverty, obviously on world trade, on healthcare cost, and impact on livestock output. I think the point that I'm trying to make here is that even though we talk about AMR in the health sector per se, and often we talk about what will be the impact on mortality and morbidity, but also on healthcare costs, actually the impact is much greater than that, as I try to highlight here. Let's come to the health sector proper. On the right-hand side of the slide, I am presenting data which comes from a publication we had as the Institute for Health Metrics and Evaluation a few months back, in which we tried to estimate the number of deaths that are associated with AMR or attributable to AMR. There is a distinction between the two. Associated means that someone is dying of an infection or another cause, and we know that there was a pathogen for which a pathogen that may have developed resistance to a number of antibiotics that the patient may have received, but you cannot for sure say that the death was caused because of the antimicrobial resistance. There may be some competing explanations for the cause of that. And those kinds of deaths, we call them associated deaths. And then we also estimated what we call the attributable deaths, in which we are pretty certain the cause of that is actually an infection which is resistant to the drugs for that particular pathogen. So here I'm presenting in a graph the number of sepsis we have globally, the number of deaths due to sepsis globally. This is in 2021, the number of bacterial infections and what percentage of that would be associated to AMR resistance and what portion of that will be attributable to AMR resistance. And the numbers are that. Actually, we estimated that 4.7 million deaths will be associated to AMR, and 1.14 million deaths will be attributable to AMR. And I also present a bit of more detailed data about the number of deaths associated to the most common drug resistance pathogens, the 6-1 and attributable deaths, etc., and also the bacteria that are often associated or with AMR resistance and the antibiotics that they are resistant to. So this is a summary slide. I think what is important here to keep in mind that this is a problem globally in all countries. There are millions of people who may be dying of AMR, either through association or the death could be directly attributable to AMR. I think this slide may be of more interest to you, more relevant for you. In this slide on the left-hand side, we have the global time trend of sepsis from 1990 to 2021. Okay, we have the number of deaths in millions on the y-axis, and this is broken into age groups. And as the AMR evolves over time, this is a 30-year time trend, okay? We see that there are less and less AMR-related deaths in infants and children, and more in older populations. Except the last 2 years, we had a lot of deaths because of COVID. Obviously, there was an association with that as well. But what is important to keep in mind that as we are getting better in treating neonatal sepsis, as we are getting better at preventing infections, which may lead to death because of AMR in children and infants, we are seeing much less death mortality in that age group. But at the same time, we see more and more death in older age groups, especially above the age of 50 all the way to 69 and 70. On the right-hand side, is a depiction of attributable and associated deaths, okay, by different age groups in 1990 and 2021. What is important in this slide that you use, what you see is that there are more and more deaths either associated with or attributable to AMR in older age populations, especially compared to 1990, right? So this trend is important to keep in mind. AMR is still a problem. It's getting maybe a bigger problem, but mostly for the older population, people over the age of 50 or so, than for the young population. And these are global statistics, of course. And here I'm presenting three maps of deaths attributable to AMR 1990, so about 30 plus years ago. In the middle, you have 2021, which is recent. And then on the right-hand side, what we project the deaths will be due to AMR in 2050. What you see here, obviously they are color codes. I don't know whether you can see it, but in 1990, we didn't have too much mortality due to AMR, except in Africa, mostly in sub-Saharan Africa, which is red. And the main reason behind this is neonatal sepsis. So children, infants actually dying of sepsis, right? And then as we get closer to our time, 2021, the number of deaths due to sepsis has gone down significantly, except in a few countries in Central Africa. But by the same token, we start seeing more deaths in the rest of the world due to AMR. But if you look at 2050, the color code is changing again. We see a lot of red, dark orange, light orange, etc. This means that you will have more AMR, but this is mostly in relation to AMR in older populations. So this is the time trend over the last 40 years plus all the way to 2050 that we are having more that's attributable to AMR in all ages. However, the relative weight in different age groups will be shifting from younger age groups to older age groups. So now let's move on to why why AMR is becoming a major problem. I think this slide explains it all nicely. It comes from a report that we published in 2019. So there are a number of reasons why we are having AMR. First of all, obviously, misuse and overuse of antimicrobials in humans and poor access to quality, affordable medicines. Then we also use antimicrobials in terrestrial and aquatic animals, especially in the livestock sector, in the fishing sector, because in order to increase yield and reduce epidemics and outbreaks in the farming industry and the fishing industry, there is quite a bit of use of antimicrobials. Although I must say that in many countries, it is becoming highly regulated now, and especially in Europe, for example, it is no longer allowed to use antibiotics in livestock. But in other countries, they are still used, although to a lesser degree. Another issue is the water, sanitation, and hygiene. Basically, especially in low and middle income countries, if you don't have a good potable, if you don't have potable and safe water, you don't have sanitation and hygiene, you are more likely to have infections, viral or bacterial, and as a result, people may overuse and misuse antibiotics, and there may be more resistance. The same in the food and feed industry, the same also in environment. For example, we know that in some countries where the regulations are lax, especially in the pharmaceutical manufacturing industry, that a lot of effluents can be simply released to the ground or to the rivers as an effluent which contains antibiotics. Then it may also contribute to antimicrobial resistance, and the same applies to plants, of course. So I think the idea here is that it is not just about humans, it is also about animals and livestock. It is also about what is used in the food and feed industry. It is about also water, sanitation, and hygiene, as well as on environment. This is why we have this concept of One Health. When we talk about One Health, we talk about human health, animal health, obviously, and environment, and the food industry at the same time. So with four components to it. Let's talk about what we can do about it then. There are basically two things we can do. One is, obviously, on the right-hand side, we may have the tools, that these are the antibiotics and diagnostics and vaccines. And if you use them properly and judiciously, if people have access to quality healthcare and testing, instead of using empirical antimicrobial use, if the prescription of antimicrobials is based on the identification of the pathogen, then I think we are likely to reduce the AMR-related deaths and morbidity. But sometimes we don't have any available tools because there is already a widespread resistance to a given antibiotic or to a set of antibiotics. You may have everything you want, but you don't have the antibiotics which are working any longer. Then in this case, we will have to innovate. And by innovation, we often means to the discovery of new antimicrobials, but mostly you talk about antibiotics, and mostly antibiotics against gram-negative infections where we have the big problem. So what are the solutions? The solutions, we have to think about it in a through a multi-sectoral lens. It is not about health and healthcare, as I mentioned. It is multi-sectoral. One health, that is human health, animal health, environment, and food and feed industry. I think it is very important to think about this, not just a problem between the providers and the patients, but it is also an issue of governance of the health sector. That means laws, rules, regulations, and enforcement of those things. Leadership. It is important that in countries, leaders in the health sector or in other sectors as well, they advocate for judicial use antimicrobials, whether for human health or for animal health. It is obviously financing is very important for all kinds of reasons, but mostly for research and development and innovation. But also it is important to have very good intelligence, that is surveillance, that we can monitor continuously the trends in the AMR evolution. Sometimes in the global health arena, people talk about the duality of access versus excess. Basically, what they mean by that there's a problem in many developing countries where access to antimicrobials is not guaranteed because the many antibiotics or antimicrobials are simply not affordable. And then the people from the developing countries, they often say that in the West, in more developed countries, they are using antimicrobials excessively. And that's also the reason why we are having this problem. I think this is not a good way of approaching it. In a way that we say either or, it's an access problem or excess problem. I think we are all in the same boat, globally speaking, and that we all have something to contribute to the reduction or containment of AMR. So in about 6 years ago, the United Nations Secretary General established an interagency coordination group on AMR. So what it means really, in the UN parlance, that means that people representing different entities, either UN agencies like World Health Organization, World Animal Health Organization, or the multilateral development banks like the World Bank, they come together, analyze the data, and come up with a number of recommendations that could be passed on to the Secretary General of the UN, which may take actions, based on that evidence. So that group, Interagency Coordination Group, came up with 5 groups of recommendations. So they meant basically accelerating country progress, innovate to secure the future, collaborate for more effective action, invest for a sustainable response, and strengthening accountability and global governance. Obviously, I realize these are a lot of words, but there are details about that. And for those who are interested, we can go into detail later on in the Q&A session. So,
sorry, Dr. Barris, I do have to ask you to wrap up just shortly, just so that we have time for the other presenters. So hopefully we can pick up on some of these other topics in the discussion.
Okay, I'm about to finish anyways. So this is basically how we do advocate based on our research. I mentioned to you that we published a report in September 24, and this is the key takeaways, my last slide, okay? So we first, we have observed that there has been a reduction in infectious diseases, and hopefully it contributes to the significant reductions in AMR. We have to think about prevention of infections and mostly vaccines, but also hygiene. The AMR is going to stay with us so long as access to quality treatment and healthcare remains inequitable. This is a global concern, but also at the same time, local concern at the country level. Intelligence, public health intelligence is essential, basically meaning that we have to keep an eye on the progress of AMR and the drug-bug combinations that are becoming of major concern. And we all have a role to play as healthcare providers and patients alike. So thank you very much for this opportunity. Thank you.
Thank you so much, Dr. Bears, for that comprehensive presentation that has really helped to kind of help this set the scene for other presenters and for the rest of our discussion. So I'm now going to hand the floor over to Miss Mary Lynn Van Polgies Pomfret, who is the president of the World Federation of Incontinence and Pelvic Problems and a longstanding international patient advocate promoting the rights of patients at both national and international levels. Ms. Van Polgies Pomfret is a member of several patient advocacy movements and organizations like the International Alliance of Patient Organizations and as well as the European Patients Forum. So I'll hand the floor over to you, Mary Lynn.
Thank you very much. Hello, everyone. Good morning, good afternoon, good evening. I'm very pleased to be here and quite humbled in the presence of my two fellow presenters. And I realize, given the fact that I've only got a few minutes now, is to give you a brief snapshot, a glimpse of some of my thoughts surrounding this aspect of antimicrobial resistance. What I did last night, actually, I was in bed thinking about how I was going to approach this. And one of the things that I find recurring words, themes that come up. So I'll just mention them before I start talking about the rest. One of them, antimicrobial resistance, is a challenge. Patients and people need reassurance. We all need, as Dr. Ennis has just said, to collaborate, multi-sectorial. We have to fight, but we can't fight alone. We have to listen. We have to educate. We have to adhere to medications, and we have to act. And the time for action, as we know, is now. Next slide, please. Next slide, please. Yes. So, no, the one before. Yes. So what is the role, if you like, of patient organizations and people like myself is to raise awareness among the general public, patients, general public, and of course, as we've mentioned, the decision makers. They're key in this whole aspect of how we tackle antimicrobial resistance. And how do we do that? Well, we have a week like this week, the World Antimicrobial Awareness Week. And what I did was just take a couple of campaigns. If we move on to the next slide. Next one. I'm going quickly because I can see what the time is doing. Okay, so what do we do? First of all, we've got to understand what an AMR is and its impact on patients. So my organization, the WFIPP, the World Federation of Incontinence and Pelvic Problems, has been looking at AMR, and primarily because we see the ever-increasing recurrence and increase in urinary tract infections, which overprescription of antimicrobials has been causing a much larger figures in this. So that's one of the main reasons why I'm here and why we're working on that together with other organizations, as you'll see in a moment. For example, the European Patients Forum, of which the WFIPP is a member, has launched a toolkit, and I'm going to give you the link in a moment, to actually raise awareness on antimicrobial resistance. So if we go on to the next slide, that's the link there. I'm sorry, I tried to make a better link, but it does actually work because patient organizations and their role is absolutely key in this fight against AMR. And this new campaign, if you go through it, you'll see there's an awful lot of information, communication on the safe use of antibiotics. So that's where you can find it. And of course, you get so many different types of audiences. Some are health literate, some are not. And This is, if you like, the work of patient organizations and civil society organizations to bring that together to the general public, to patients, caregivers alike, and see how we can have a very robust response to AMR. Next slide, please. This is the role of patient organizations, as I say, and because of the time factor, I'm going to let you read that and not go through everything. But one thing that is important is that patient organizations can play a very key role in combating antimicrobial resistance and being one of the players in the whole multi-sectorial chain, as has been mentioned. Next slide. This, probably many of you have seen this, been in a lot of social media posts about it in the last few days, the AMR narrative. That this is one of the examples of toolkits, and it's a brilliant toolkit. I went through it yesterday to raise awareness, especially this week. So if you look at that link, you'll go straight to this AMR narrative. I'm working very closely with one of the WHO patient representatives called Vanessa Carter, who some of you may have heard of, and she's a leading advocate and a Joan of Arc, if you like, in leading on how to combat AMR. She's an AMR survivor herself. Next slide. This is the European Patients Forum, what they have to say about antimicrobial resistance, and this goes back to the toolkit, which I've just mentioned. Next slide. This is what the EPF says, call for great involvement of patient organizations, again, with the link. So if you perhaps maybe later you can find those links, or I'm sure the IFA will supply those links, which leads you to a vast array of documentation material you can use. One of the things I'd like to mention, actually, now that I think of it, is unmet patient needs in this respect. One of them is the lack of access to diagnostics. Without going into the detail of that, it's extremely difficult to actually find out what antimicrobials are present in a particular person, and I'll tell you why in a moment. Next slide. What we have to do, therefore, is increase awareness, as we've been saying. And what is key in all this, as you'll be seeing the whole of this week, are personal stories. They are powerful. And I won't go into the detail now because I'm conscious of the time. My own personal story as a partner, my husband, who has antimicrobial resistance to contend with that. And what actually happened is that the prescribed dosage of antibiotics intravenously, which he was administered, the pharmacist misread the dosage and he ended up with almost getting 10 times the dosage. So you can imagine that I'm a very keen promoter to try and obviate those situations which almost were dire and fatal. So if anyone wants to hear our story, it's quite a poignant story, but we haven't got time now. That's maybe for another time. Next slide. So AMR, I see it, and many of us see it as a tsunami. It is a tsunami. We need better outcomes. We need to fight. We need to act. We need to influence the decision makers. And we need a global action in the EU alone this last year, and I'm talking about 2023, 35,000 people alone died of some form of antimicrobial resistance. So we have to channel our efforts and make sure that we work for better outcomes, better participation, better adherence, and the only way we can do that is together. I'll leave it at that so Pilar has time to do her talk. Thank you very much.
Thank you so much, Marilyn, for that presentation and for also sharing a little bit of your personal story. So now I'm going to hand the floor over to Dr. Pilar Ramon Pardo, who's the Antimicrobial Resistance Program Chief at the Pan American Health Organization, or PAHO, where she has spearheaded efforts against the critical challenge of AMR across the Americas for over 15 years. So Dr. Ramon Pardo, greatly look forward to your presentation. I'll hand the floor over to you.
So thank you so much for the invitation, and thank you so much for the opportunity as well for the Pan American Health Organization. We are the regional office of the World Health Organization in America to be with you today in this fantastic week where we are raising awareness on antimicrobial resistance. So thank you so much for the organizers, the International Federation on Aging, for this fantastic webinar. I think that we are discussing, I think it's a very innovative way discussing about the impact of antimicrobial resistant AMR on the elderly population. And I think that this is really a little bit overlooked in general in the different aspects of public health, in the policies, even in different clinical settings. So this webinar is a fantastic opportunity, as I said, yes, to resonate the slogan of the World Antimicrobial Awareness Week 2024 is educate, advocate, and act now. So this is the time. Now, let me just go quickly through my presentation. It will be available for you all. I believe that as well this webinar will be recorded, and you will have the chance as well to go in the details. So I had 3 points. One is to better understand the burden of AMR in aging population. The second is as well got into the deep dive and understand better the burden, why it is happening, and responding to the needs, and then the conclusions, which is the way forward, the patient-centered approach. So let's start with the burden. And maybe you remember, but as Dr. Baris mentioned, this year, the 26th of September, a couple of months ago, there was a political declaration, high-level political declaration in the United Nations General Assembly about a commitment of the countries to respond to antimicrobial resistance. That was the day, that was the political declaration. You can go in the details. But just to mention that in the targets that was discussed and agreed among all the countries in the world, there was one important one. The first one, the most important, is the commitment to reduce the global deaths caused by antimicrobial resistance by 10% by 2030, again against the baseline in 2019. Later we can discuss that. But the important thing is this agreement to decrease the deaths by 10%. But in order to do that, we need to understand better where are these deaths, in which niche of population is happening. Many of the data that you are going to see in this presentation comes as well from the same source of Dr. Baris, is the IHME data, is from the University of Washington. And this is one of the most impressive tweeters on AMR. So here you will see the projection, what is going to be happening in the increase of mortality related to AMR worldwide. But I would like to highlight not only the total number, but who the age group of this where it will have the biggest burden. And you will see it will be the more age population, the people older than 70 years old. This is striking. This is important. We need to act now and prevent this death in the population. We know the population, but as well, we need to know from the public health perspective to know exactly where is this burden, in which region of the world, in which country, so we can be better focus the interventions and the policies and the strategies from the international public health arena. So this is the information as well. I will really invite you to visit this fantastic tool. You have the website there. We can include that in the chat. And then we are going to see where, in which region of the world these deaths are going to happen as of today and probably in the future. So as the estimation from 2021, a couple of years ago, most of the deaths were happening in the most populated areas of the world. South Asia, East Asia, Eastern Asia. This is just in absolute numbers. But if we look at the rates, the highest rates, they are in the low-income countries, mostly in sub-Saharan Africa. And of course, at the end, the countries that will be less affected, to the regions that will be less affected, they are the high-income countries. You will see that there are two different shadows. The bright one is the related datum associated to antimicrobial resistance, and the darker one is that the deaths that they are directly attributable to antimicrobial resistance. But you will see here where is the problem actually in the currently in the world. Okay, I think that Dr. Baris as well made an important statement, a message. So the burden of AMR is basically at the both ends of the life, right? In the babies, especially under 5 years old, and as well in the elderly population. So in this graph, we are trying to compare both the pathogens in both sides, in the adults or older than 70 years old, children less than 5 years old, just to check if they are the same pathogens or they are different pathogens. And you will be surprised because the first number one, let's say number one killer for adults will be Staphylococcus aureus with a specific resistant pattern, and as well it's many times acquired in the hospitals. And then E. coli is very frequent, that urinary pathogen. And the third one will be Streptococcus pneumoniae. And for the children under 5, the first one is Streptococcus pneumoniae, followed by many other pathogens acquired at the hospital. So first message here, Streptococcus pneumoniae is, okay, number 3 for adult population and number 1 for children. And we have a vaccine. So first message, we need to reinforce the vaccine both in elderly population and as well in under 5 in the childhood, as is the regular vaccination programs. But this is important, it's an important message. And as well, the relevance of infection acquired during the healthcare, acquired in the hospital. This as well is a call for improve the infection prevention and control measures in the hospitals. Let's move to the next one. We are going to understand better what is specifically for an adult population and responding to the needs. So I will strongly recommend you to go through this fantastic reading about it's a comprehensive analysis review about the mechanism, risk factor, and solution of antimicrobial resistance in elderly population. We don't have the time. Maybe we will have time for question and answers, but really, it's worth it to go through this paper. And I will just capture one of the most striking graphs and very clear graphs that we can better understand what are starting from the risk factor, specifically for elderly population, the risk factors going from different, you probably are familiar with the immunosenescence, like frailty, sarcopenia, malnutrition, cognitive impairment, decreased mobility. So there are many risk factors specific for elderly population that make more easier to get, more easy to get infection from multi-drug resistant organisms. And we are going to see another graph after that, but this is not only the organism, but as well the mechanism of resistance. And then the outcomes. They are clear. You will have prolonged, longer hospitalization, and as well promoting the transmission inside the hospital. The patient will need broader spectrum of antibiotics that as well will create more resistant, but as well, many times they are more toxic than the narrow-spectrum antibiotics. And of course, they are much more expensive, which is relevant for the access to antimicrobials in low, middle-income settings. And as well, this resistance will increase complication, mortality, and health cost. The solutions are here. They are listed. They are, of course, getting novel antibiotics that will be accessible, high quality for everybody, innovative therapies to be accessible as well and available for the people that need that. Vaccine stewardship program, meaning that the antimicrobials should be used under certain parameters, and as well diagnosis. This is critical. So we need accurate diagnosis to be able to identify the pathogen and the resistant mechanism to be able to focus the antimicrobial treatment. So as said, this is like a brief summary of the paper, and I invite you to go to that. This is as well the pathogens that they are related to the highest burden, especially, and I just have this graphic because it's specifically for long-term care facilities, and I think it's relevant as well to look at this kind of facility. And as you will see, the most frequent pathogens are E. coli, methicillin-resistant Staphylococcus aureus. Both of them, they are as well easily transmitted in this kind of facilities. They are not exactly, they are, you see, they are not in the same order than the lethality that we were seeing in the first graph in the first slides. And that is because sometimes the frequency of this, here we are seeing the frequency, so the frequency is higher for E. coli, but the lethality is higher for Staphylococcus aureus. That is why in the first graph, the order is inverse. Okay. We are going now to see to the last one, going from the burden to the conclusions. And I would like just to highlight as well that from the WHO, the World Health Organization, we are moving more and more through a patient-centered approach. And when we are speaking about patient-centered approach, we need to look at all the spectrum of the patient that normally go, or the people that normally go and seek care in the healthcare facilities. So elderly population is part of this people-centered approach. And the innovation is that the discussion now is going from this different system challenge to the including people challenge, and going in the pathway that all the people, including, and with as well, I would like to highlight the elderly population and trying to look specifically to the system challenge and people challenge for the elderly population in the prevention of the infection, access to health services, diagnosis, and treatment. After that analysis, there was a whole package of 13 interventions going as well: prevention, access, diagnosis, and appropriate and quality assured treatment. All of these pillars are perfectly applicable to elderly population and should be, right? The intervention should be discussed, should be implemented specifically for that population. And the other important piece, communities. I am not speaking specifically from the patient point of view, as Marilyn already mentioned. We are looking at the power of the community in the supporting the different members, including elderly, but as well children and others, to raise awareness and to work together and to support each other tackling antimicrobial resistance. And this is a lot of different interventions that could be done on community level. Could be improving nutrition, improving vaccination, improving hygiene, improving food safety. So there are many different aspects that should be done in the community as well. Why not? Traditional medicine that could be used as well for treatment of symptoms on a specific treatment that maybe will decrease the need of antibiotics. We need that the communities, they have a lot of power, and then they was as well, they were just to close the circle, they were present as well. They were participating in the UN General Assembly in different satellite events, raising the voice and requesting to the health, to the governments, the action to tackle antimicrobial resistance. So this is the call for the global action in the UN General Assembly, and just trying to move the political will and to decrease antimicrobial resistance. This is a photo of the event. act on AMR now. And with that, I will close my remarks and give the floor back to the moderators. Thank you. Thank you very much.
Thank you so much, Pilar, for that presentation, and thank you to all of our speakers. So I'll just ask you all to turn your cameras back on just for the final few minutes of our webinar here. So I think it's very clear from all of your presentations that AMR is, you know, an outstanding issue, particularly for older people. This is something that, you know, all of you have expressed that, you know, the burden of disease really is in older populations. So in the final minutes of our session, I'm wondering if we can kind of focus on actions and interventions and hear a little bit from all of you on what's sort of your key takeaway action to either NGOs or patient organizations, or, you know, perhaps Dr. Bear, some of the groups that you work with in your kind of academia and research. So I'm hoping that I can go around and just get your kind of takeaway intervention that we should be focusing on for AMR. So Pilar, maybe I'll start with you this time, and then we'll go backwards through the group.
Okay, so my takeaway, I think that especially looking at the relevance of in the political arena of AMR, I think that the takeaway will be to increase awareness, to raise the topic as exactly as we are doing in this webinar. So AMR in older population in the rate is not overlooked anymore, and it has a specific attention from the health policies, but as well for the intervention and as well in the communities. So we need to stress the importance of AMR in elderly population at all the levels in the healthcare. That will be my, yes, raise awareness as we are doing.
Thank you so much. Marilyn, I'll go to you.
Yes, indeed, raise awareness. And of course, we're not just talking about patient organizations, we're talking about public, general public health communities, as Pilar pointed out. And I think it's our job as, how should I say, proponents of how to do this. We really need to fight this famous AMR tsunami. We can't leave it. We must act now. As I said, we've seen the facts and figures. I deliberately didn't go into the facts and figures and left it to my colleagues to do that. But what is, it's dire, the situation, and it's far worse than we think it is. And that message needs to be got across to the communities, to patients, to caregivers, but in a way that we don't frighten them off. One thing, especially if we're talking about the aging population, we have to be very careful how we approach this, and we have to do it in a way that's suited to the needs of each particular individual. It's a tall order, but that's the only way that we're going to decrease the prescriptions, the number of unnecessary prescriptions, for example, and also to get people to adhere to their medications, which, as we know, is a big challenge. And the other thing is diagnostics. We need better diagnostics. A lot more I could say, but we haven't got time.
Yeah. Thank you, Marilyn. It's true that we're really only scratching the surface. Okay, Ines, last but not least, any kind of final takeaway messages on interventions to combat AMR?
Just a few things. I think, first of all, it is very important to empower patients so they can actually talk with the healthcare providers at an equal level instead of just accepting whatever they will have to say. Because we also know that in many countries, depending upon the modes of remuneration, there may be tendency to prescribe more, to provide more healthcare, and some of it may be inappropriate. So there is a role to play here. The second thing is important for the ministries of health or agencies that are responsible for keeping an eye on service delivery to actually see the trends in antimicrobial prescription. And when they see that there is an increase or there is not enough decrease, so they will have to act on it. I think that is very, very important. The third thing is that I think proper, prescription and utilization of antimicrobials, especially in low and middle income country, will have to be really beefed up. I have seen in my career in many countries, I don't want to name them, that sometimes you can buy antibiotics in, regular stores. You don't even have to go to a drugstore, right? And then, they may take 5 and then stop because they feel better. So I don't want to get into too much detail, but I think it is very important to keep an eye on that and really enforce proper use of antimicrobials.
Well, thank you so much to all three of you. And I think some really nice key takeaways. And hopefully we'll be able to have you all back to dive a little bit deeper into all of the strategies and all the things that we only touched very, very lightly today. So thank you so much for all of you for providing your expertise this Global AMR Awareness Week. So there are a number of links and resources and things like that were shared from all of you. So some of them have been added to the chat, but also some of them I encourage everyone to check back on the IFA webpage to explore those resources further and also take in all of the learning that's going on this Global AMR Awareness Week. And then lastly, thank you to GSK Canada that has very graciously supported this event, as well as to the whole IFA team that makes these webinars happen, and particularly Carly Moore, who has led this project. So thank you so much to all of you. And as I said, this is the beginning of conversation, and hopefully we'll be able to have you all back to discuss more.
That would be good.
Thank you so much.
Yes.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you. Bye.